Drug resistance, particularly of antibiotics, and the overprescription of antibiotics to patients by doctors is now a health hazard, making it a cause for concern globally. Zimbabwe is now working on an antimicrobial resistance One Health National Action Plan to deal with antimicrobial drug resistance.
The microbes affect human beings and cause disease. Over time, since the 1930s, science has developed agents that would then treat these microbes. What has been emerging recently is that there is now resistance to the use of the same agents to treat the microbes. So as a nation, we've come together from the medical science, from the veterinary science, to then formulate an action plan so that we can then stem the tide of resistance.
The use of antibiotics in livestock production as well as importation of meat reared using antibiotics is also a contributing factor to drug resistance as they affect the human body's resistance to diseases.
The overuse or the irresponsible use of those antibiotics and or pesticides can lead to resistance in curing the disease.
The proper use of antibiotics will decrease antimicrobial resistance in Zimbabwe. Medical experts caution that if action is not taken soon, more people could die from drug resistance rather than from the actual diseases. The government expects the Antimicrobial Resistance Action Plan to be in place by June next year. Antimicrobial resistance is the resistance of a microorganism to an antimicrobial drug that was originally effective for treatment of infections caused by it. Too much uptake of antimicrobial agents affects patients' recovery processes, even if the right treatment is administered. Mirungu, CCTV.